health inequities arise by differences in access to preventive, acute, and chronic care. Also, differences in the quality of care received within the healthcare setting, individual differences in approach to health or health care, and differences in social, political, economic, or environment exposures. We call these the social determinants of health. And of course, they include racism and other forms of discrimination as a component.
There's actually a section of the ACA that makes it possible to do better data collection. Section 4302 actually requires data collection on race, ethnicity, and other factors. And those features of the ACA really have been underutilized in my view. So I do think that there is law in place that the administration can use to improve data collection, to improve our understanding of health equity across the board, not just for COVID, but for all of the matters that we've been talking about.
The biggest barrier in addressing social determinants of health is legacy investments. We have to move money from the current distributions to much more investment in the infrastructures I've just talked about. The best way to do that would be with an all-of-government approach to addressing social determinants. I believe personally that should be White House-led, Oval Office-led, involving all cabinet departments, not just HHS and certainly not just CMS.
We must continue to learn more about social determinants of health and how they interact, overlap, and impact cancer care. We know that they are detrimental to many of our patients, and we have to even the playing field for all of our patients.